Now, in this particular patient, at first she was a little bit skeptical, and also the first treatment, she felt a little uncomfortable, my ears were popping, and a little hyper-focused on her surroundings. And she wasn't sure if she was even gonna continue. And I said, just give it a couple. And she started to notice that the intensity of her headaches when she'd have one was less. And that those headaches were responding to the other interventions she had more quickly, and she was requiring less overall medication. And this was a great sign, and this really motivated her to do a full protocol. I'm Dr. Dan Monti, welcome. So I recently treated this 34-year-old woman who had a history of chronic migraine. This has been something she's dealt with since her teenage years. She's tried every medication ever made for migraine. And in her initial workup with me, we did a lot of things to straighten out her diet, make sure that she's not eating inflammatory foods that increase the risk of headaches, leveling out hormones, vitamins, minerals, nutrients, things like that. And all of that did help to some degree. She also tried some treatments like, injections and other newer pharmaceuticals. Again, it was better than it had been, but she still was having them more frequently than she would have liked, and more frequently than I would have liked. Usually, with the right supplementation and dietary interventions and hormonal balancing, we can get these patients in a lot better place. And she was in a better place, but more was needed. It did help a lot when we started giving her magnesium. This is often something that is deficient in migraine sufferers, but it wasn't sufficient. Now, in her history, she did have a head trauma. She remembers being about 12 or 13 when she had this sort of bike accident where she was flown from her bike. She kind of rammed into something, and she didn't have a helmet on, and she hit her head on the pavement. She was temporarily unconscious, but at the hospital, they said she had a mild concussion. Didn't look like there was any type of permanent damage. So she went home and life continued on. She doesn't know exactly when, but not long after that is when the headaches started. She knows in her teenage years, she was struggling with headaches. Her doctor at the time thought they might be related to her menstrual cycle, and that is possible. But in her case, a lot of those things were addressed. And it turned out that what might have likely been behind this chronic headache situation is that original head trauma. One thing that's emerging as a treatment for people who've had a head trauma and for people who have chronic headaches is hyperbaric oxygen therapy. Now at the Marcus Institute, we have a medical grade machine, and I thought, let's try this out with her. Let's give her a course of hyperbaric oxygen to see if that has the healing effect we're looking for. Basically, you're in a pressurized chamber that increases the oxygenation of the blood. This was originally developed for scuba divers who came up from the pressure too quickly and got nitrogen sickness, so to speak. The nitrogen bubbles causing pains, the bends, and they're in a hypoxic state at that point. So the hyperbaric oxygen actually balances it in a way. And so what was found soon after is that the hyperbaric oxygen was enormously helpful in tissues that weren't healing well. So people who had wounds that weren't resolving, things like gangrene, diabetic foot ulcers that had to be operated on. So these open gaping wounds, part of the problem was that the blood supply, the capillary supply to these injured areas was limited. And so by increasing oxygenation through being in the chamber, you then could get the healing effects you're looking for. So one way to look at it, if we're at 1 atmosphere at level ground, as we sort of go up a mountain, it goes lower and lower to maybe half an atmosphere as we're mountain climbing, for example. And that's why people are short of breath. They notice that lightheadedness because they're not oxygenating as much. And even people who fly to a higher altitude to just go skiing or snowboarding, there's often a period of time to acclimate to being at lower atmospheric pressure. Now, think the opposite. When we're increasing the pressure, you're going down into the ocean. So instead of it going lower, it goes higher each level that you go down. We aim to get to about 2 atmospheres of pressure, which then allows the oxygen to flood the tissues and reach some of those areas that it may not be getting to in an efficient way. And when that occurs, there are multiple different biochemical and immune processes that get kicked off. And that's really where the healing occurs. Now, in this particular patient, at first she was a little bit skeptical. And also the first treatment, she felt a little uncomfortable. My ears were popping and a little hyper-focused on her surroundings. And she wasn't sure if she was even going to continue. And I said, just give it a couple. The thing about hyperbaric oxygen treatment is that you generally need more than one. Now, sometimes we see people who've just gotten surgery and they have swelling. And we see the swelling go down after just one treatment, but you generally require several treatments to get the full effect because there's certain things that sort of kick in when the body feels the atmospheric pressure increase. There's a learned response after the first or second treatment. And so then the next time she felt more relaxed and more at ease. She kind of got to the pressure she needed to rather quickly, and so she felt fine. But, didn't notice a lot. But she did give it the 5 or 6 that I asked her to. Then she started to notice after a few that her brain felt lighter. Those were her words. She felt lighter. And she started to notice that the intensity of her headaches when she'd have one was less. And that those headaches were responding to the other interventions she had more quickly, and she was requiring less overall medication. And this was a great sign, and this really motivated her to do a full protocol. And so for us, a full protocol is 20 to 30, and she did. She wanted to go beyond it because over the course of those 20 plus sessions, she actually felt the lights come on in her brain in a way that she didn't even know they were off. She felt like she was thinking better, focusing better, concentrating better. Whatever healing effect that was occurring from that old head injury was improving more than just her headaches. And this is often the case when somebody's had a head injury. Some of the ways that they're compensating and accommodating, they're not even conscious of anymore. And the healing effect that occurred from the hyperbaric oxygen addressed things that weren't even in her conscious awareness. In general, our healing time tends to slow as we age because of several factors. One of them is our entire vascular system. We develop plaques. The system is less efficient. So healing of injuries, of wounds, of surgical procedures is much quicker when people get hyperbaric oxygen, particularly if they have any kinds of issues with healing or healing time. For our machine, I have to protect it for the patients that really need it. Otherwise, it would be filled up with the local plastic surgeons in the area who want their patients to heal faster from facelifts, and they do, or from other, sometimes when they have reconstructive breast surgery after cancer, for example. Those can be really long healing times, and the plastic surgeons know that if they send them over for the hyperbaric oxygen, those women are going to heal faster, and the swelling goes down much faster. And so for those types of patients, it really is a quality of life thing that we like helping them. You may have heard that professional sports teams are using hyperbaric oxygen. In fact, I know many that are, when people get injured, because it does speed up the healing time. So the thing about hyperbaric oxygen is to get to the 2 atmospheres, you really do need a medical grade machine. And most of the hospitals, including the hospital that is associated with our university, use them for very severe cases. Now, our clinic has them for some of these other things, but that's not so common to find. There are lower grade machines. By lower grade, I mean they can get to a certain level, maybe 1.5 atmospheres, but not to the 2 or 2.5 that we would use for more severe cases, may actually have some benefit. There's early data out there that shows that there's a healing potential by just going up have an atmosphere. What I would hope to see as more and more data comes out about the positive effects of hyperbaric oxygen is that more and more outpatient clinics will have this as an available service for people who need to get up to that medical grade of pressure. And I think that this is going to make healing times from complicated surgeries, but also complicated neurological issues such as traumatic brain injury, concussive injuries, and things like that really go a lot better. I'm Dr. Dan Monti. Until next time, be well.